Hello everyone, I'm Dr. Nawal Mohammed. Today I'm back again with the topic of nose, anatomy and physiology. So we are done with the topics of ear. Now we have dived into nose. So we're going to start today with anatomy and physiology of nose. So first, before we start, we'll just have a go through about the topics. These are the topics that we'll be covering. It's on your screen. We'll have lateral wall of the nose, an important topic, followed by nasal septum. How does olfaction work? And what is mucociliary mechanism of nose, blood supply of nose, basically the anatomy of nose. So why to choose Auricle? Because we have recorded classes, we have live classes, we have practical sessions, exam modules, hard copy book sets. And recorded classes are the classes where you can come in, look at it, re-review it, review it, use it as a revision platform. The recorded videos will be live classes, videos will be recorded. You can go through it and any subject or any topic you want to clear off, you can use this recorded platform. Live classes, like one we have now, where we used last 10 years of question papers to create topics. So we teach you only those topics live. We make sure that you're thorough with the topic. We have a one-on-one question answer session where if you have any doubts, you can clear that during live classes. And we'll have MCQ polls, Viva votes, and much more. Exam Express module is where we cover entire syllabus in 20 hours. Now, this is just like a crash course, just a revision before you go for exam. So if you're done with the thorough studying, then only you can follow up with Express exam module, because the entire syllabus here will be covered in just 20 hours. That's just, of course, before your exam. And about one-to-one doubt clearing sessions, anyone have any doubt? We have these sessions where we provide tips on answering questions and we highlight important points to include in the answers during examination and to present yourself in the examination and how to write the answer sheet and all. Hard copy note sets are the place where our professional experts have created these textbooks like patterns. I think it's in an question answer pattern. So you can have an access to hard copy note sets. If you cannot keep up with the textbooks, you can use these hard copy note sets. Question bank, you can download this app in your Android or iOS, and you can use it in your mobile phone or tablet or anywhere. You have 3 levels of expertise here. It's a customizable question bank, beneficial for NEET PGs and FMGs, and also for students who are going to write their academic exams. Practical sessions, we also make sure that the students are well prepared before they leave for their practical exam. How do you present in front of the examiner? What will you expect from an internal or an external examiner? So we'll cover up that in practical sessions. Now, the subscription part, we have 4 plans. It's on your screens. First 2 plans, you will not have all the benefits, but last 2 plans, you'll have all the benefits. You can use the QR code DRNAWALMOHAMMED20 for discount on any subscription. Now let's move to the topic of nose. So this is the anatomy of nose. This is when you cut the head in between, the skull from between, and you see only one part of the nail. So both the parts are like this, just for your view. Now, to create a framework, nose has 2 parts. We say it is an external part of the nose, which we are able to see, and the internal part of the nose, which is the picture that we have seen above. Okay. The external part of the nose consists of skin, right? It is made up of nasal musculature. We have muscles. Osteocartilaginous frameworks are covered with muscles, and we have cartilaginous part. Now, cartilaginous part consists of upper lateral cartilage, lower lateral cartilage, lesser alar, and septal cartilage. So, cartilaginous part upper lateral, lower lateral, and then we have septum. Lesser alar part. All right. So the upper lateral cartilage, they fuse with each other and with the upper border of the septal cartilage in the midline anterior part. Just remember that the lower free edge of upper lateral cartilage is seen intranasally. Okay. And lower lateral cartilage or alar cartilage is U-shaped cartilage. Lesser alar cartilages, they lie above the lateral alar cartilage. So lateral cartilage, if I draw the structure of nose like this is your lateral cartilage. All right. And you have lesser alar cartilage. Lateral cartilage, lesser alar cartilage. And then you have alar cartilage. So alar cartilage is this part, just this part of your nose. So different. So this is alar part. All right. So you have lateral cartilage, that's the whole. And then you have lesser alar cartilage, that's this part. And then you have alar cartilage right on the tip. And then you have septal cartilage, that's the base. This part is the septal cartilage. Nasal bone, lateral cartilage, septal cartilage, alar cartilage, and we have here lesser alar cartilage in this part. All right. So upper lateral, lower lateral, lesser salar, and septum. Just remember it this way. Skin, and you have osteocartilaginous framework covered by muscles. Now, coming to the internal part of the nose, the internal part of the nose is in two forms. One is vestibuli of the nose, and one is the nasal cavity of the nose. Now, what does it mean by, okay, internal part of the nose, again, it is divided into right and left nasal cavities, and it is divided by nasal septum. Every one of us knows. And the holes that we have, the openings that we have in the nose is known as nares or nostrils, right? So vestibuli of the nose, the anterior and inferior part of the nasal cavity. So this is your anterior part, right? The one that is in front is the anterior part, and the inferior part of the nasal cavity is called as vestibuli. Just have to imagine the anterior and the inferior part of the nasal cavity is known as vestibuli. Now it is lined by skin. It contains subcutaneous glands and hair follicles. So vestibuli of the nose, anterior and inferior part. Now we are talking about the internal part of the nose, lined by skin, contains hair follicles, and glands. All right. Now, nasal cavity proper. Now, when you go inside the nose properly, each nasal cavity has a lateral wall. Okay, the wall that is on the lateral side, and then there is a medial wall, roof, and floor. So we can imagine like a nose, when you're going inside, it's like a box. Okay, so you have lateral sides, you have roof, you have floor, and you have a medial wall. This will be your septum. Laterals, roof, floor, medial wall. All right. So now the important thing that we should cover for our examinations is lateral nasal wall. So lateral nasal wall, actually, if this is your nose and this is nares, it is divided into three parts. Okay. Your nose is divided into three parts. One is superior concha. Then you have middle concha. And then you have inferior concha. Superior, medial, middle, and you have inferior concha. Now, each of these concha have specific structures within them. So, inferior concha, it is a separate bone. So, these two bones will be in ethmoid. The superior and the middle concha will be in ethmoids. And this will be a separate bone. That's your inferior. Middle, superior. All right. Superior, middle, and inferior concha. Now, every concha will have a meatus. So, inferior meatus is in the inferior concha. So, I'll erase this so that I can draw. So, inferior concha will have inferior meatus, and inferior meatus will look like this. We have a diagram down here. So this is inferior concha and inferior meatus. So inferior meatus is in the inner part of inferior concha and it opens into nasolacrimal duct. So your lacrimal duct also have some connections to the side of the nose. That's why when you have itchy nose and when you have allergy, your eyes will also water because it is connected. So inferior concha will open into nasal lacrimal duct. So this is here. And then you have medial turbinate. Now medial turbinate is important part. And medial turbinate or medial meatus, it presents with the opening. Now it has three openings: anterior third, middle third, and posterior third. So middle meatus will open to the middle and ethmoidal cells. So first of all, they'll have middle and ethmoidal cells. So here we have here ethmoidal cells. Okay. And then below that, it will open into sinuses. That is frontal sinus, maxillary sinus. Like this. All right. So we have two sinuses opening, frontal sinus and maxillary sinus, and we have sinus of middle and ethmoidal cells opening. Now the superior meatus, it lies in the superior concha and it receives from, the opening from posterior ethmoidal cells. Okay. Yeah. All right. So inferior turbinate it is a separate bone. Inferior concha is a separate bone. Superior concha and middle concha both are openings of they are the structures of ethmoid bone. Regardless of that, we have meatus. We have inferior meatus, which is underneath the inferior concha, right? And it opens into the nasolacrimal duct. We have middle meatus, which opens into the middle concha and it has opening of middle and ethmoidal sinuses along with frontal and maxillary sinuses. So we have superior meatus that opens into the superior concha. It is an opening of posterior ethmoidal sinuses. Apart from that, we have sphenoethmoidal recess. Okay, we'll go back to this diagram. I'm unable to scroll it down. Just give me a moment. here. So you have sphenoethmoidal recess, right? Here, exactly here. So let's imagine it. This is your superior concha, middle concha, inferior concha. You can see inferior meatus in the inferior concha, right? It is an opening to nasolacrimal duct. Then in the middle concha, you have ethmoidal bulla, right? You have ethmoidal cells, middle ethmoidal air cells. And the superior part, you have an sphenoethmoidal recess. And it also opens up into posterior ethmoidal air sinuses. I hope you have a clear picture now of the lateral part of the nose. Now moving ahead, this is how it will look. It's the same picture. You'll have a frontal sinus here. You have an uncinate process. This is the uncinate process, a depression in the lateral part of the nose. So uncinate process is like a hook structure that it runs from the anterior superior. So if you can see, it is running anterior superior to posterior inferior. Uncinate process, hook-like. Anterior superior to posterior inferior. All right. And the gap, the two is called the hiatus semilunaris, but we don't have it here. I think we have it in the first diagram. Yeah, see here. The gap between the two are called as hiatus semilunaris. So it's the posterior superior border is sharp and it will run parallel to the anterior border. So this gap between the anterior and the posterior part is known as hiatus semilunaris. Just remember that uncinate process is like a hook-shaped structure that runs anterior superior to posterior inferior direction. And it has gap between the two. It is known as hiatus semilunaris in the inferior part. All right. So superior meatus, what is superior meatus? It is a space below superior turbinate and posterior ethmoidal sinus opens into it. Remember the openings, please. Inferior turbinate will open into the nasolacrimal duct. Middle turbinate will open into the maxillary sinus. It will open into the frontal sinus, right? And it will open into the ethmoid air cells. And we have superior meatus that opens into the posterior ethmoidal sinuses. And we have something called sphenoidal recess that is a sphenoid sinus that opens into it on the top part. Now coming to the part of nasal septum. Nasal septum is a structure that will divide your nose into two, right? So you have nasal septum, you have a roof and a floor to the nasal septum. So nasal septum's roof has an anterior sloping, it has a posterior sloping, and it has a middle horizontal part. Anterior sloping, posterior sloping, and a middle horizontal part. Now, these are formed by cibriform plate of ethmoid. Now, from the cibriform plate of ethmoid, the olfactory nerves enter into the nasal cavity. So, anterior sloping, posterior sloping, and middle horizontal sloping. So, middle horizontal sloping is formed from cibriform plate. Anterior sloping is formed by nasal bones. And posterior sloping is formed by sphenoid bone. Now, this is very important to write in the exam. So, in the exam, if they ask you nasal septum, you should put the heading nasal septum and then put two. The best way to write all these is in the flow chart manner. So, you put two arrows and then you write roof and floor, write anterior sloping formed by nasal bones, posterior sloping formed by sphenoidal bone, and middle horizontal part formed by cibriform plate. Now, from cibriform plate, the olfactory nerve enters into the nasal cavity. If you write it, it's better. So you can write olfactory nerve. enter into nasal cavity. Coming to the floor part, it is formed by palatine process. So just imagine this is your nasal septum. The roof you have told, the anterior sloping, posterior sloping, and middle horizontal part. Right? The floor is formed by the palate. So if you open your mouth, the structure just below your nose is the palate, right? So it is formed by palatine process of the maxilla. Okay. So it is formed by palatine process of the maxilla in its anterior 3/4 and horizontal part of palatine bone in posterior 1/4. So if this is your nasal septum, let's make a lip here. So this is palate. So anterior 3/4 is made by maxilla, sorry. And posterior is made by palatine bone. Okay, so this is all about the nasal septum. It is the medial wall. So you know about the lateral walls now. Two lateral walls. It has three concars or three turbinates, right? And everyone has its specific opening, which you should know. And then you have medial wall. Medial wall is nasal septum. It has a roof and a floor. So now you have completely covered the internal cavity of the nose. That is the two lateral walls, floor, roof, and the medial wall. Okay. Now moving ahead. Okay, this is the nasal septum. And one clinical anatomy that everyone should know is that majority of the people will have nasal septum deviated. Some will have drastically deviated, some will have mildly deviated. So this is how it will look like. It will be either turbinating or it will be completely towards the left or completely towards the right, depending upon the intensity. So this is nasal septum. This part is your floor, roof, and the two lateral walls with medial wall. Coming to the part of olfaction. Now, olfaction we have studied in our first year as well. Olfaction, olfactory nerve, how does it work, and the nerve supply and all. So the nerve supply of the nose is by olfactory nerve. So the olfactory nerve, they carry the sense of smell and supply olfactory region of the nose. Now, olfactory region of the nose, this is important, the olfactory bulb. So we can imagine this is where your brain will be. Okay, this is nose. So they are the central filaments of the olfactory nerves, and they are arranged like in 15 to 20 nerves that they will pass from the cibriform plate. So if you can see, they are passing from the cibriform plate here. This is called cibriform plate. And they end in the olfactory bulb. Now, these nerves can carry sheets of dura. They'll have arachidoid and pia with them into the nose. And injury to these nerves will also cause, insomnia. Apart from that, these infection in this region will open infection to CSF as well because your bone is in direct proximity with the olfactory bulb. Your brain is in direct proximity with olfactory bulb. So any infection that can pass through the nerves can enter into the brain and CSF space as well, just like rhinorrhea and meningitis, right? So this is the overall framework of how the olfactory nerves will be. You can see that we have an anterior ethmoidal node where we have olfactory bulb. We have ethmoidal nerve here. This is ethmoidal nerve, right? And you have branches of sphenopalatine ganglion. So these are palatine nerves. Can you see it? Can you see palatine nerves? Can you see posterior inferior lateral nasal nerve? Don't have to remember all the nerves. Just remember there is olfactory bulb. Three main nerves that everyone should know is anterior ethmoidal nerve, and then you should know branches of sphenopalatine ganglion, and the third thing is infraorbital nerve, just close to your ears. All right. So these are nerve supplies. Anterior superior quadrant is supplied by anterior ethmoidal nerve. Anterior superior quadrant is supplied by anterior ethmoidal nerve. Anterior inferior quadrant is supplied by alveolar nerves. And posterior superior and posterior inferior quadrants are supplied by pterygopalatine nerves. Just remember these three nerves. We have olfactory nerve bulb, anterior ethmoidal nerve, infraorbital nerve, and branches of sphenopalatine ganglion. Now, moving ahead to the pathway of olfactory nerves. This is the pathway. We have learned it in physiology as well. The pathway of olfactory nerves. Olfactory nerves will get stimulated when the mucous membrane sends down the smell sensations to the olfactory rod. And from the olfactory rod, this will be passed on to the olfactory receptors placed in the nerves. And then from there, it crosses through the cibriform plate and enters into the olfactory glomerulus. And from olfactory glomerulus, it will pass on to the olfactory tract. Okay, so you have to remember the steps. You just draw the diagram in the exam so that you can get perk marks. It's not like you have done it in physiology, so it's not required in ENT. They will ask you pathways of olfactory nerve, and everyone should know it. Remember, you have an anterior ethmoidal nerve that is common for sensation. You have sphenopalatine ganglion, and you have branches of inferior orbital nerve. All these will supply the vestibuli of the nose. And if you just remember these nerves, that is more than enough for anatomy. Now, coming to the topic of mucociliary clearance of nose. So what is mucociliary clearance of nose? Mucociliary clearance of nose is, it involves the coordinated process to protect the entire nose from bacterial infections invading it. So microorganisms should not invade your nose. That's why you have something, a process called as mucociliary clearance. So it involves maxillary sinus, it will involve frontal sinus, and it will involve sphenoidal sinus, and it will involve ethmoidal sinus as well. So all these sinuses are involved in mucociliary clearance of nose. So what does it happen? So you have something called globate cells and mucosal, submucosal glands. So the sinuses that are lined within your nasal cavity, what they will do is that they will produce mucus. Now this mucus is produced to trap the dust, bacteria, and other particles. So nasal mucosa is actually very rich in globate cells and secretory gland cells. Now, both of these play an important role called as mucus blanket. So you have globate cells and secretory cells. Together, they create a mucus blanket. All right. So what happens here is that your sinus lining produces mucus. Now, globate cells and mucus, submucosal gland cells, these are in the respiratory tracts, and they will start to secrete mucus so that they trap any bacteria or particles that enters into your nasal cavity. Then what will happen is that the cilia will push the mucus to the openings. So ciliated epithelial cells, they will beat in the rhythmic manner and they will start to push the mucus upwards towards the pharynx. All right, and where it is actually swallowed. So if you can see here, tiny hair-like cilia on the sinuses walls constantly beat in a coordinated way, moving the mucus towards the small openings called ostia. Now this will connect the sinuses to the nasal cavity. Then the third thing what will happen is that the mucus will drain into the nasal cavity. That is, it will start to drain in the nasal cavity, and then it is the final clearance. So this is the steps that you can write it. Anyone who's following Dhingra, it is mentioned in a small paragraph, and they have mentioned about conveyor belt in it. So you don't have to really bother about it. You can just write it in this form that it has your nasal nose has a sinus lining that produces mucus, and each sinus cavity produces mucus that traps the particles, followed by the cilia is pushing the mucus to the specific openings. Now, it means that they have tiny hair-like cells which will move in a coordinated way. So mucus blankets will consist now in Dhingra, what they did is that they have mentioned that mucus layers are has a superficial mucosal layer and deep serosal layer. And on the top, there will be cilia floating towards it, and they will like act like a conveyor belt towards the nasopharynx. That's not actually not required for the information, but then you should know it. All right. But this is the best way that you can write a sinus lining mucus. And then you have cilia that pushes the mucus towards the opening, and mucus will drain into the nasal cavity, followed by the final clearance. Once in the throat, the mucus is swallowed or either expelled out, clearing the particles and preventing infection. All right. So dust particles are actually entrapped on the viscous mucus blankets, right? And what will happen is that these mucus blankets will carry them to the nasopharynx to get swallowed. So these are actually, this is all about the mucus clearance test. It is a self-defense mechanism done by your nasal cavity. Coming to the blood supply of nose. Now, this is important because you will also have a whole chapter on the blood supply of the nose, and also you'll have a topic called epistaxis. It is important. So the nose, that is in center of your lower body and your head, right? It's between. So you have blood supply from the internal carotid artery, and you have blood supply from the external carotid artery. These are the main branches. Now, the examiners will ask you in the exam, what is the main artery that supplies the nose? You don't have to get confused, because actually the nasal cavity is supplied by a lot of branches, which are the branches of internal and external carotid artery. You should tell them it's internal and external carotid artery with the main branches. That gives off specific branch to the specific part of the nose. Now, internal carotid artery will give off a branch called as ophthalmic artery. Ophthalmic artery will divide into anterior ethmoidal artery that supplies the anterior part of the ethmoid bone, and the posterior ethmoidal artery that supplies the posterior part of the ethmoidal bone. Okay. And then external carotid artery will again divide into two. One will go behind and one will go forward. Okay. The one that goes behind is a branch of sphenopalatine artery. And the one that goes forwards will give a branch, septal branch. Okay. Of course, we have two branches in between, maxillary artery here, facial artery here. So imagine a nose like a box, right? You have nasoseptum here. Now, if you turn it other side, you just see this part of the nose. Internal carotid artery, external carotid artery. External carotid artery, one will go behind, one will move forward, one will give septal branch. right? Other will give sphenopalatine artery. Internal carotid artery will give an anterior ethmoidal artery and posterior ethmoidal artery. Now, all these arteries will move ahead and come in between. So it's like a round table conference, let's say, like a square table conference. All the arteries will move and they will join together. They'll just come close to each other on one point. Now, this point is known as Little's area. So when you have nasal bleeding, you're advised to pinch the tip of the nose because the main part that bleeds is the branches in the Little's area. Okay, so it is called as Little's area, where the branches of anterior ethmoidal artery, sphenopalatine artery, septal artery, and of course a branch of greater palatine artery also comes and joins together. And if there is a leakage there, though that Little's area will start to bleed and it creates epistaxis. That's why you're advised to pinch the tip of the nose when there is epistaxis. Apart from that, in epistaxis, if the bleeding doesn't stop even after pinching the part of the nose, then you can assume that the main branch, that is the sphenopalatine artery, is bleeding. So and usually in the exams they will ask you epistaxis is bleeding of which branch of the artery, which artery bleeds in epistaxis. So it should be sphenopalatine artery. So in that case, when the bleeding doesn't stop even after pinching the tip of the nose, you just do packing. You pack the nose. You stuff cotton inside the nose so that it creates vasoconstriction and stops bleeding. Because epistaxis is a whole other chapter on that. But before that, everyone should be thorough about the anatomy of the nose. Remember, anatomy of the nose. Medial wall we have, and we have two lateral walls, floor and roof and floor. Lateral walls, anatomy is very important. Three concha, three turbinates. Each turbinate has specific opening. Remember those openings. It's quite easy. Don't forget to draw a diagram in the exam so that you get a perk point. Followed by just know the physiology of mucociliary clearance. It's just that your nasal mucosa secretes some mucus, and it functions to trap the particles in the nose, and they will send it to the openings, and from openings you just swallow it or expel it out from the nasopharynx. Apart from that, don't forget the nerve supply of the nose. Remember the three main nerves of olfaction. So it's anterior ethmoidal nerve, branches of sphenopalatine ganglion and inferior orbital nerve. Remember, you have an olfactory bulb. Do not forget to study about the olfactory pathway, just in case they might even ask you as a bouncer in exam. So you should know olfactory pathway. It's not just for first year, it will continue for the upcoming years as well. And then followed by, you should know about the arterial supply of the nose, that is the blood supply of the nose. Remember, sphenopalatine artery is the main culprit for epistaxis, and Little's area is the place where all the arteries of the nose will come and join together, right? So that area bleeds heavily. So today's topic was very short. I hope you liked it, and that's it for today. Thank you.